All right. Well, good morning. I'm Tanya Stevenson. I'm the CEO of the Myotonic Dystrophy Foundation, and it is a great privilege and pleasure to welcome you all to the 2025 MDF International Conference. We're really glad you're here. Yeah, it is. Thank you all for traveling to Indianapolis, and a special thank you to all of those joining virtually via the Zoom events platform. During this session, it is my very huge, great joy to share with you about the progress of the foundation and what we've been up to since we last met. I'm also joined this morning by my colleagues, Mindy Buchanan, who is our Director of Programs, and Andy Rohrwasser, who is our Chief Scientific Officer. I also just want to take a quick second to express my gratitude to all of the professionals who started their conference experience yesterday with almost an entirely full day of conference sessions, and to the DMCRN for hosting the Cardiac Endpoint Workshop, and to Eurodyma for co-hosting Pharma Day with us yesterday. So thank you all. Okay, so why are we all here? We all envision a world with treatments and a cure for myotonic dystrophy. MDF's mission of community care and a cure remains the focus of our work. We support and connect the myotonic dystrophy community. We provide resources and advocate for care, and we accelerate research towards treatments and a cure. So you may be wondering when you look around, who is in this room? This is our largest conference ever, with over 600 people in person at the conference, yes, and another 100 virtually. So we have over 700 people at this conference. About 60% of folks who are attending are affected individuals and family members and friends. About 25% are researchers and healthcare professionals who are focused on myotonic dystrophy. And just over 15% are from industry or other nonprofits or from government. All of you right now are representing at least 34 US states and Puerto Rico, 9 countries, and many of you are coming from as far away as Australia and China and Japan and Chile. So thank you for being here. So nearly 32,000 people have connected closely with MDF since our inception in 2007. This includes families, clinicians, researchers, industry professionals, regulators, donors, and other allies. Through our email and newsletters, we're connecting actively and communicating actively with over 13,000 people each month. And we see an increase in connections with the foundation of about 2,000 people each year. We have made significant progress, huge strides over the last year. In your conference bags, you have a 2024 annual report. And for those who are joining on Zoom, there should be a PDF on the Zoom platform. You'll find more information about the work that we did last year if you want to dig in a little bit, but I'm just going to give you a quick overview of some of the things that we focused on in the last year. So we invested over $4 million towards community care and a cure. We hosted 6 regional conferences across the US, achieving record attendance of 737 people connected. We significantly expanded community connections through MDF support groups, webinars, and social media. We proudly committed more than $1 million to research through our fellowship and grant program. And we raised from all of you over $3 million last year. Thank you and congratulations. Yeah. So this year we're working on several critical priorities. We've increased advocacy efforts to maintain federal funding for myotonic dystrophy for both research and for critical services like Medicaid. We're connecting DM families with clinical trials and studies to help advance drug development. We're engaging with key constituents in anticipation of drug trials and actual approvals. We're launching a clinician education initiative, a campaign to help improve patient care. And we're working to improve our MDF resources because we've got lots of feedback from lots of people in our community, and we're hoping to make them more accessible and easier to use. Okay, it's my pleasure to introduce Mindy Buchanan, our Director of Programs, who's going to talk a little bit more about our care and community programs.
Thank you, Tanya, and good morning, everybody. I'm excited to share with you a little bit about the work that MDF has been doing in 2024 for our programs and provide a sneak peek of what we're going to be doing in 2025. So our conferences are here today, continue to be a cornerstone of education and connection for our community and our professionals. And this year's our 16th international conference, also called our Family Conference. And as Tanya mentioned, there's over 600 of us here today. The pandemic had allowed us to connect from all over the world in a way that we had never done before. And we are committed to ensuring that families and professionals have access to the rich content provided at our conferences. And this is actually our 5th virtual conference and our 3rd hybrid conference. And we have over 100 folks joining us online today. In 2024, as Tanya mentioned, we did take ourselves on the road with the 737 folks in person and across 6 regional conferences. And our international conference remains the nexus of the DM ecosystem, bringing all of us together here. All right. So as I mentioned, I'm going to talk a little bit more about our conferences. Last year, 2024 was a truly record year. Not only did we see the highest number of in-person attendees we've ever seen over the 6 conferences, we also had more first-timers than we've ever had before, with nearly half of every single conference full of first-time attendees. These regional locations also provided opportunities for our communities to connect with the local researchers and participate in research through our additional sessions for research they got to do some research. They even got to extract DNA from strawberries at University of Florida and some other locations. And we also participated in Grand Rounds and the Medical School Roadshow to further our clinical education efforts. So some of the greatest challenges we've heard from our community, which led us to looking at the regional option, included access to knowledgeable providers, connections to other local community members, and access to research opportunities. So by bringing our conferences together, we were able to connect families to local experts, research opportunities, and crucially, one another. As you can see from the maps on the left, the regional conferences drew the largest number of attendees from the local area, though folks did travel some distances, including some of our international attendees. This helped alleviate the travel burden for many families who are not able to travel those longer distances and made sure that folks are connected to those critically important local resources. MDF also provides, if you didn't know this, we provide one-on-one connection all year long. Whether you're a healthcare provider looking for clinical care resources, or you're somebody living with DM, or you love somebody with DM, we have the resources and available opportunities for you. And everybody who calls us receives direct contact with an MDF staff member, as well as a 2-week follow-up for folks to ensure that they got what they needed the first time they called us and make sure there isn't anything else that we want to share with them. And as you can see here on the right, this is the type of opportunities and resources that MDF shares across all the stakeholders, which folks call us with a number of different requests, and sometimes they request all the things, and we provide that too. So some of our most common requests, as I mentioned, are our printable and downloadable resources. With nearly 20 guidelines for community and 15 for clinical care, MDF provides the widest and most comprehensive range of resources specific to myotonic dystrophy in the world, which is why we have nearly every single one of our resources translated into at least one language, but many of them are translated into multiple languages. Some of our newest resources from 2024 include a practical advice for anesthesia for individuals with DM, DM in the Heart, a community guide, exercising and DM infographic, and DM resources and support flyer, all of which you can find in the exhibitor hall at the DM resources table today. We also have more than 250 videos in our digital academy, which equates to over 200 hours of content with DM experts from around the world. You can also check out pages 30 through 31 in your programs, which gives you the full list of all of our resources. On the left, you'll see resources for community, and on the right, in blue, you'll see resources for providers that you can share with your healthcare provider. Many of you know and have probably received the MDF Toolkit, and we've had this for more than 10 years, and it has helped thousands of families throughout its tenure. We are very excited to share that this year we'll be launching a revised and improved toolkit for our community. Through hosting focus groups, listening sessions, and convening community committees, we are in the final stages of development of this new version of the toolkit. Well, I should actually say 2 toolkits, because we are actually, through our learnings and our community, we understand how important it is for our DM2 families to walk away with a resource that's just for them. So these 2 new toolkits will be separately specific to DM1 and DM2, and they'll include updated and independent resources inside, like the anesthesia guide, as well as special section for our most requested clinical care guidelines to share with your healthcare providers easily. So for many years, MDF has provided support groups across the US and internationally. When the pandemic hit, our support groups transitioned to the virtual environment, and today we have 37 support groups in virtual, hybrid, and in-person formats. With many regional and topic-based type support groups, we definitely have a support groups for you. And if it's not a support group you're after, we also have happy hour every Friday, virtual happy hour every Friday, and 5 different Facebook groups. In 2024, our 48 amazing support group facilitators, often called SGFs, hosted over 2,500 attendees at their support groups, providing much needed support for our community. And last year, MDF was able to provide our first multi-day training for our support group facilitators to ensure they continue to have the knowledge and access to resources they need to do their work. I want to extend a heartfelt thank you to our support group facilitators who volunteer their time, energy, and hearts to supporting their community. And if you'd like to say hello to our support group facilitators, they have their very own table over there in the exhibit hall, and you can stop by and say hello. They also have a ribbon on their badge that says support group facilitators, so make sure you stop by and chat with them. Another excellent resource we host is the Ask the Experts webinar series, held monthly after the conference. These webinars are community informed and provide crucial access to DM experts no matter where you live. With more than 13,000 attendees and views since the program launched in 2021, this webinar series remains one of our most popular programs. On the left here, you can see our most recent webinars from 2024, which are available through our digital academy. And on the right, beginning this year in June, you can see our upcoming webinars that have been requested from our community committees that we'll be hosting, including the emotional journey of DM, understanding and managing vision challenges, genetics of DM, and pediatric growth hormones and metabolic health. This year, we're thrilled to share that for the first time, our Ask the Experts webinars will be available in closed caption foreign languages. Additionally, we're very excited to share that you only need to register once for the entire series, and you get access the whole year long. And don't worry if you miss anything, because it's always going to be available on our digital academy after it ends. For the last 3 years, MDF has brought over 17,000 people closer to the DM drug developers to ensure that the community knows about the progress of drug development and can ask live questions. Our Meet the DM Drug Developer webinars are also available after the fact through our digital academy, and they'll begin later this year. They'll begin again later this year. I'm proud to share that MDF continues to expand our reach through translated resources. the support and holding support groups in multiple languages and website hubs in different languages. In partnership with our community leaders, we now have a dedicated Spanish and German language hubs on our website to make accessing those resources easier for folks in those languages. And coming in 2025, we're excited to share that we will have a French language hub on our website. And we've already started this year with a French language support group. Our website remains our #1 resource across the world. And last year, the DM community accessed our website from over 200 countries and territories. So last July, we launched our very first ever Myotonic Dystrophy in Motion Awareness Month. We had over 130 participants from 14 countries who came together to celebrate and engage in movement and community through live webinars and networking buddy activities in this month-long event. We're excited to say it's back again this year, and we'll be hosting movement classes every Monday in July and educational webinars along with community virtual happy hours and movement competitions. So stop by the MDF resources table to learn more about In Motion Awareness Month and get this year's collectible and limited edition t-shirt or sweatshirt. And the first 50 US registrants will receive a MDF exercise band. As I mentioned, the MDF website is our #1 resource across the globe, and we aim to make it even better and more user-friendly this year. We know how important it is for our stakeholders to quickly access information and support they're looking for, and our website redesign aims to ensure that everyone who accesses the site will have that experience. If you would like to provide your input, feedback about our existing website, or your hopes for our redesign, stop by the MDF resources table, speak to one of the MDF staff members, that's the folks with the white lanyards and the staff ribbon, or scan the QR code on the MDF resources table to take the survey. One of our most used resources on our website is our Find the Doctor map. And we are excited to announce a redesign of this extremely important tool. The new version will be more user-friendly, as well as provide a more accurate list of providers who understand DM, along with specific tags to make it easier for families to understand what type of DM the provider may have experience in. I want to extend a special thank you to those of you who are part of our amazing Find the Doctor Map Redesign Community Committee. Thank you so much for dedicating your time and effort and brain power to this really big endeavor. As Tanya mentioned earlier, one of MDF's priorities for 2025 includes our clinical education initiative. This year, we'll be focused on our clinical outreach campaign to reach out to providers not yet in the DM space and provide information and clinical care guidelines to ensure that community members who are seeking providers are finding providers that are knowledgeable about DM. We're also exploring continuing education programming to offer to clinicians for DM education. And a sneak peek of information you'll receive a little bit later is you'll hear about is our survey to help MDF understand knowledge and skill gaps for providers. So what can you do to help? We get a lot of folks saying, how can I help with clinical education? I'm going to share that now. You can share our new clinical education pamphlet with your healthcare provider. That's available at the MDF resources table. This quick read brochure ensures healthcare providers know about MDF's clinical care and community printable resources. And on this, you'll also find information about a new resource called our DM Essentials box. Our DM Essentials box is free for healthcare providers to order from us and is full of printed resources for clinicians to place in their waiting rooms or share with their patients who are affected by DM. So pick up one of those brochures and share it with your provider at your next visit. And you can also ask your healthcare provider to take the DM Insight survey, which you'll hear a little bit more about shortly. It's now my great pleasure to introduce my colleague, MDF's Chief Scientific Officer, Andy.
Welcome, everyone, and thank you very much, Mindy and Tanya. So in this in this next session, we talk about cure and really about our efforts to advance research, right, and eliminate barriers to drug development. So a key resource to advance science and clinical care are grant, and over $15 million dedicated to research since 2007. Over 7 million have directly supported grants which are directed towards research and progress in care. So you see here the first program is the MDF Research Fellows program and the grants, and that's really the hallmark of the foundation. So it's a 2-year fellowship program for doctoral and postdoctoral scientists, and it generates the next generation of DM researchers. It's also our flagship program with over 5 million in funding to date. You might ask, well, is this working? And we think so, because over 80% of the scientists that have been funded through this mechanism, they remain in the field. And many of them, especially the first generation and second generation, they are now thought leaders in our community. The second mechanism you see here is the early career grant mechanism. And here we did something, it's also a 2-year fellowship program, again, dedicated towards improvement of care and treatment. And last year, we split this mechanism into 2 dedicated sub-tracks. So the first sub-track supports basic scientists, and the second sub-track supports clinician scientists. So clinicians who also see patients for them to excel in their career. The last mechanism is our pilot grants and small grants. And I'm really excited about this because it's a high risk, high reward grant mechanisms for younger investigators to generate preliminary data. Preliminary data is necessary and required to apply for subsequent larger grants with either larger foundations or with federal agencies. And then the small grant project is really dedicated towards the dissemination of knowledge, right? So here we support publications, so they're in the public domain, or we enable traveling to conferences like this year for researchers to share their findings in form of posters and presentations. So what do we fund? Well, first of all, you see in this slide here that funding has been directed towards all aspects of the disease. So grant projects have supported DM1, CDM, and DM2 research project. It's really, really exciting, right, that we see that the number of DM applications have significantly increased over the years. And I wanted to digress here a little bit. During the last review of our pilot program cycles, 2 of the 2 projects funded were DM2 projects. High profile project, it's really exciting. So overall, the quality of the submitted application has been continuously and significantly improving. So we have now to reject proposals that are still good, but we have so many that we cannot fund all of them. When we look at what is being funded, you see the pie chart to your right, and you see that about roughly half of the projects, they fund basic molecular mechanism, topics of genetics and so forth. But the other half of the proposal, they really target organ or tissue-specific disease mechanisms. So including projects investigating the effects on the central nervous system, brain, muscle, or the heart. You also see that we have another category here where we have emerging topics where scientists advance proposals for GI issues or sleep issues. So when we look at where do the researchers reside that we fund, then we see and we can conclude that our grant program is really an international deal. 65 awardees reside in the US, but then 14 are outside the US. So we have fellows and recipients in Canada, we have them in the UK, and we have them in Europe. This is my favorite slide of the presentation, and you get to hear more of that, of course, because it's really the objective indicator of progress and hope for patients as well as families. So it's a summary of commercial drug development programs that are in the clinical testing phase. And while you see 10 programs here, there are really 20 commercial programs we know of that are active in this space. So it's also really, really exciting to see, right? When you look at this table, you see small biotech companies, but you see also the really, really big players, right? Who obviously see a need to be active in this space. You also see, and it's probably too much detail on this slide, right? And that these development programs, they target various mechanisms and aspects of the disease. And don't worry, we have 2 more sessions where you get to hear from the drug developer companies directly in more in-depth presentation. Significant efforts of our team are dedicated towards clinical trial readiness and success. Because if you think about it, that's really, really important, right? To get treatments for you to stop the suffering. So we are in the process of performing a systematic assessment of the gaps, the barriers, and the needs with industry partners, the community, so you, the patients, and the families and the caregivers, as well as regulators, as well as the key clinical opinion leaders and the clinical trial leaders. So this process is still ongoing, but we have some information about the outcome. So from the industry partners, we learned about their desire to hold a scientific session with the FDA. They also stressed the need for an MDF convened structured approach to advance our understanding of meaningful clinical trial endpoints. And then industry partners also stressed the need to advance the development of biomarkers, as well as the need for a large and integrated and inclusive registry. The DM community expressed a desire to improve the convenience of clinical trials and the need for better trial education. So education about the ins and outs of how trials are conducted, inclusion, exclusion criteria, and so forth. As well as, in alignment what the industry folks said, the advancements, to really focus on meaningful trial endpoints that reflect your experience. Regulators, so FDA representatives, they also suggest a data-driven scientific session, which would include alignment of trial endpoints, again, with what matters most to you in your experience. While the survey for the principal investigators and the KOLs is still ongoing, we'll send that out in the next coming weeks. A key priority for this group was to maximize trial capacity and trial resources. And if you want to learn more about that, we have a link on this slide, the yellow box. Please, if this is of interest, go and attend this session. I think it will be great. So the Myotonic Dystrophy Foundation also supports and hosts the DM Family Registry. This is a patient registry to advance research and drug development, and it's the world's largest DM-only patient registry. The registry has been steadily growing to now over 3,000 individuals registered, which is great. The registry contains patient-reported outcomes to inform us and the community about the true disease impact. So, for example, what symptoms starts when, what are the most common symptoms, and how symptoms progress. And here I want to digress a second time, and I hope you all know Sophia Almos. She's our registry coordinator, and she, during the last half a year, led an amazing analysis project where we took a deep dive into the registry data, and we cleaned records, and we were able to distill really interesting information and show significant correlation between your patient-reported outcomes, age of onset, symptom prevalence, disease severity, and repeat information. And again, I love science, so please go visit with Sophia and talk to her about these findings, and then you actually see your data in action. So that brings me to my next point. That's the second plea. Please connect with Sophia also and update your records. We heard earlier from Dr. Basset from Paris, and who leads the French registry, and it's the most powerful tool to accelerate drug development and research. So please go there. Check in whether your records are updated. It's super important. It helps the community. We need it. All of us need it, and you need it. So please do so. So if you cannot participate in interventional clinical trials, there are many opportunities for research to participate, and many of them are right here at the conference. So a few examples. So Indiana School of Medicine is conducting a pilot study to better understand speech and swallowing problems in patients, in DM1 patients. Stanford University School of Medicine has presents two studies here. One of them invites you to participate in collecting movement data to develop digital biomarkers in DM1 and DM2. The University of Florida is studying possible causes of sleep disruption in DM patients with a special focus on DM2. Then the University of Rochester is here with their REACH-DM study. Their focus are children and adults with DM1, and you are invited to participate in a short study with a blood draw for genetic testing, surveys, and then functional measurements. And then last but not least, Wake Forest University School of Medicine is here conducting research to better understand the cognitive challenges in patients with adult onset DM1. So please visit them in the exhibit hall. Just talk to them, right? And and see whether you're fit, right? Whether this is of interest to you. You help them, you help all of us. So please do so. So I want to close my section with an update on newborn screening. So we have begun the engagement of the community with this very important public health measure. So the foundation, together with the RNA Institute in New York, we convened a first meeting to bring together DM experts as well as the experts in newborn screening. So we held an in-person one-day meeting on Valentine's Day this year, and we brought together policymakers, public health practitioners, and experts in newborn screening. And we actually identified high-level steps and opportunities we can take today towards that longer-term process and goal. What is newborn screening? Well, newborn screening is the most successful public health measure in the US and worldwide, and it aims to identify babies at risk before the onset of symptoms. So irrespective of socioeconomic status, irrespective where you live, everyone gets the same start. And with the advancement and development of treatments, effective treatments, we have to begin thinking about applying these drugs as early as possible and to the youngest population we serve. So in this meeting, we identified real life opportunities and next steps we can engage now. And with this, I hand it back over to Tanya. Please come and talk to me in the hallway. I always love talking about science, and many of you know me from attending support groups. So don't be shy. Thank you.
Thank you, Andy. Okay, we're going to spend a few minutes talking about how you can help protect and advance the research and the trials that are currently in progress. So I have some good news and some not so good news. I'm going to start with the good news. So we continue to successfully advocate for federal funding for myotonic dystrophy research. Our advocacy has resulted in over $23 million awarded to DM researchers directly through the U.S. Department of Defense Peer Review Medical Research Program, or PRMRP. Myotonic dystrophy specifically is one of 50 different conditions that are eligible for research funding through the PRMRP program. And we are currently the only muscular dystrophy that is eligible for this special funding. But we must regain eligibility each year. So MDF and many of you in this room ask our senators to include DM on the list of conditions eligible for the funding every year. So if we're not successful advocates and we can't convince one of our senators to add DM to the list, no funding will be available through the Department of Defense for our researchers. So to date, we have secured 8 consecutive years of this funding for DM research, and we are currently working on the 9th year. This year, we're also campaigning to secure an additional $10 million for research through the Department of Defense's congressionally directed medical research program, or CDMRP. And that is decided by both the House and the Senate. It's very difficult funding to secure. We know we tried last year. We were not successful, but we are up for the challenge and we are going to continue. Okay, so now for the not so great news. Since January, changes in US government policies have significantly impacted DM research. Funding through programs like PRMRP, which I talked about being instrumental funders of DM for the last 8 years, has been reduced by 57%. So for us, that means there's less money available, and we're going to see increased competition for the funding that is available. Staff and funding cuts at the FDA will slow the review process for drug applications, delaying drug approvals. Similarly, cuts at the NIH, or the National Institutes of Health, have delayed the review of DM research grants. This is affecting both veteran scientists in DM as well as our newcomers. With fewer funds, many labs are struggling to hire staff, risking the loss of our DM researchers to other fields. Indirect costs, which often cover essential program resources like lab equipment and staff, are also being reduced. This will make it even harder to maintain DM science labs and more difficult to hire graduate students and early career scientists who would otherwise dedicate their careers to myotonic dystrophy research. These policy changes have significantly disrupted DM research. These funding cuts may also affect clinical trials. Currently, DM clinical trials are not affected by these policies directly. Our industry sponsors are covering these trials, but the trial sites themselves often depend on federal funding to cover site operations in different ways. So if these funds are reduced, trial sites could face staffing shortages and infrastructure issues, which could potentially slow or even stop trials altogether. This means FDA-approved treatments could take longer to reach our families. So you may have guessed, given the serious nature of this situation, our advocacy, everyone's advocacy, is more important than ever. Every single minute of delayed research moves us farther away from an approved treatment. I'm not okay with this. I don't think you're okay with this. MDF is not okay with any of these delays. So to combat some of this, we have definitely tried. We coordinated 3 advocacy campaigns using the new online voter voice platform. This has allowed our community, many of you, to send nearly 2,700 letters to Congress to let them know that these challenges will affect your life. I requested to testify before Congress about how these new policies will impact myotonic dystrophy research and other rare diseases that affect over 30 million people in the United States. But you can guess that they weren't super interested in hearing at the time from us. MDF has also engaged with media more recently to help clear up confusion that many people have about the impact of these cuts on our research community. We are now attempting to secure advocacy captains in all 50 US states to ensure that we have constituents meeting with policymakers, sharing their stories, and ensuring that the policymakers are aware of the risks and ultimately the impact on securing an approved drug. I welcome you to talk more about this with Kevin Brennan, our advocacy consultant in Washington, D.C., who has been working with us for the last 10 years to make some of this progress possible. And he's having a fireside chat tomorrow at 4:00, so you can talk with him more intimately. And there's also a table, and he is standing at that table right now to talk with him at the advocacy table specifically. Well, advocacy certainly is not happening in the US alone. In 2021, DM advocacy advanced worldwide when we launched the Global Alliance for Myotonic Dystrophy Awareness. The Global Alliance works to raise awareness of myotonic dystrophy to help improve healthcare, research, drug development, and policymaking. All the members of the Alliance strongly believe that increased funding for research will improve health outcomes, reduce disability, and increase life expectancy for individuals living with DM. We started with 21 members in 2021. We've grown the Global Alliance to over 61 members in 16 countries across 5 continents. Members include nonprofits and charity organizations, hospitals and clinics, academic and other research institutions, and industry partners focused on developing treatments for myotonic dystrophy. We have a lot of people in the Alliance that are here with us today. In fact, if you are a member of the Global Alliance, if your institution is a member of the Global Alliance and you see one of your logos up here, would you please stand up? Okay, well, one of the things that the Global Alliance first did in 2021 was to designate September 15th as International Myotonic Dystrophy Awareness Day. This will be the 5th year that we are celebrating September 15th, and we hope that you will too. Here in these photos, you see families and DM research labs and industry partners celebrating last year in France and Canada and in the US. And here you see buildings, landmarks, bridges that are lit up green on September 15th. And these are only a few of the photos that were taken all over the world. And these particular photos represent Canada, the US, England, and Scotland. I invite you to work with your local community to find landmarks, to find bridges, to find something that you can light up for September 15th and light it up green. If you need help trying to decide or to determine what type of letter or request to make, please do reach out to us so we can help. So right now, MDF is preparing for the first drug approval for myotonic dystrophy. We're meeting with the FDA. We're providing data and gathering data as needed. We're meeting with insurance companies who will later decide if those drugs are covered in their plans. We're meeting with and we're learning from different organizations who have gone through this before. They've gone through it successfully and they have approved drugs, and we want to know what they did and how we can make it easier for us. We'll be gathering more data from the community over the next several months to help address questions that regulators or the payers may have. And we're working with our healthcare community to identify and address existing issues that may slow drug delivery when it is available. We want you to participate in this data collection and in this research. So as Mindy mentioned earlier, and I'm excited to reiterate that we just launched the DM Insight Survey. We're gathering the information from our community to help us better understand how you navigate insurance, find proper medical support, and what the real cost of living with DM might be in your house. We want to use this data to answer questions that the FDA or the payers may have. Insurance companies might be interested in what it costs when there's no support. The more data we have, the stronger our case will be, the stronger the case will be for our drug companies. So this survey right now is available to people in the US and Canada who are living with DM1 and DM2, as well as caregivers, as well as healthcare professionals. You can use this QR code to participate. We need everyone. We need as much data as possible. This code can also be found in your program on page 50. All right, we're going to switch gears for just a couple minutes and we're going to talk about how MDF funds our mini initiatives. Well, last year, we invested more than $4 million in research, care, and advocacy initiatives. 43% of our funding was dedicated to research, 32% to care and community programs, and about 9% to our advocacy programs. We are proud to run a very lean organization with passionate and dedicated staff leading these initiatives. We had more donations in 2024 than ever before. You all helped bring in $3.2 million for community care and a cure. Yeah. Thank you to everyone in this room who helped make that happen. Every dollar makes a difference in moving our mission forward. Well, half of that 3.2 million came from a record-breaking $1.6 million gala in Hollywood, California. We cannot thank the friends and family and devoted community members who helped to make it. We cannot thank them enough for helping make that happen. This year, our gala will be held back in New York City. We do a rotation, try to find a different location every year. We're back in New York City on September 18th at the Tribeca rooftop in Manhattan. You're all invited to attend. We hope you will join us to raise funds to move our mission. A huge shout out of gratitude to the creative and inspiring grassroots fundraisers in our community who ran, walked, rolled, and swung their way through their fundraising campaigns on our behalf. From Facebook fundraisers to golf events to a 206-mile bike ride, a full marathon. Our community stepped up with pride to contribute to changing the future of this disease and raising awareness where they can. We now have a do-it-yourself or DIY fundraiser toolkit that might help make it a little bit easier for folks who are considering this. And we have a fantastic development director, Scarlett Chidgey, who will be happy to talk with you about how you might be able to do a personal fundraiser as well. You can go to myotonic.org/DIY to learn a little more. So speaking of do-it-yourself fundraisers, yesterday, Pat Cornell took off on a 125-day journey to ride 1,000 miles a day on his Indian motorcycle to raise funds for MDF. With the goal of setting a world record for the longest continuous ride in the country, Pat hopes to raise at least $25,000 for MDF. And he was successful yesterday, his first day. He did ride 1,000 miles on his motorcycle. So yeah, let's give it up for Pat. Yeah. They're still building out the website because he just launched. So you can check out as that continues to sort of evolve, and that's give.myotonic.org/Pat125. So I'm truly grateful for the incredible team that helps power our DM ecosystem. Their passion, expertise, their drive are the heart of everything we do, propelling us towards a brighter future for the DM community. These are the faces of the almost 50 different volunteer support group facilitators who work to provide safe spaces for people living with a disease, caregivers, and other family members. These are the dedicated individuals who donate their time, their energy, sometimes their money, to ensure that nobody has to experience DM alone. And you can find more about the different topic and geography-based support groups that are held on pages 34 and 35. Okay, the 12 members of MDF Scientific Advisory Committee are some of the world's foremost experts in myotonic dystrophy research and care. Representing a global network in the US, Canada, France, and the UK, these visionary professionals volunteer their time and expertise to strategically guide MDF's research investments. Several times a year, they meet to review our grant applications and fellowship proposals, evaluating their scientific merit, and ensuring that MDF funds innovative, cutting-edge science that brings us one step closer to groundbreaking treatments and ultimately a cure. And MDF's board of directors is the backbone of our organization, guiding us with unwavering commitment as they work relentlessly towards our mission. As our governing body, they not only provide essential financial oversight, but they also chart the strategic course that drives our progress. These 12 extraordinary individuals selflessly dedicate countless hours every year to ensure the long-term success of MDF and, in turn, the future of myotonic dystrophy research and care. And these are the remarkable individuals that I have the honor of working alongside every single day, the MDF staff. They're the driving force behind our programs and initiatives. Each of them has committed to working tirelessly, not just for the cause, but for you, the people in this room. We work for you to help improve quality of life and work towards better treatment availability and a cure for myotonic dystrophy. I encourage you to take a moment to talk with our team if you see them. While you're here, you can look for the ribbons on our badges that say MDF staff, or we are wearing white lanyards. And if you have an opportunity, grab somebody, introduce yourself, let them know who you are, ask them questions. I would say that without a doubt at all, these are the most passionate, committed, inspiring people that I have ever had the privilege of working with. Their success is absolutely no accident. It comes from their deep belief in our mission, their unwavering faith in our community, and their genuine trust and support in one another. And our success certainly would not be possible without the help and assistance of the incredible consultants and interns who dedicate their talents and passions to advancing our mission. So right now, these folks are focused on advocacy, research, and resource development, and they do play a vital role in helping us move the mission and turn our vision into reality. I want to give a huge consultants and interns, absolutely. I also want to thank our industry sponsors who helped make this conference possible. It's a huge endeavor. It is very expensive when we have 600 people in person, and we would not be able to do that without the support of Avidity Biosciences, who is our lead sponsor of the conference, as well as Dyne Therapeutics, Pepgen, Artex Biotech, Vertex, Sanofi, Novartis, AMO Pharma, and Lupin Neurosciences. We wouldn't be able to do this, so yes, please give them a hand. Thank you. Okay, thank you all for attending. You can find on pages 4 and 5 of your program what the next sessions are, so you can go to the breakout sessions. And I just want to remind you, we are really excited and hope to see you back this evening for the Murder Mystery Masquerade Dinner in this room. So thank you, everyone. Enjoy the conference.